I wanted to find out what social isolation actually means. I think a lot of people have a lot of different definitions about it, and you see a lot of different things everywhere. So keen to hear Jane, Jasmine.
Term that gets confused and conflated with loneliness and other things like social connection and depression, and it can be used interchangeably, so it makes it pretty confusing. But social isolation is objective isolation, so it's not a feeling like loneliness, where you can objectively have very limited to no connections that's available to you. So that would be, older people in residential aged care, a lot of them do experience social isolation. So the stats like, I think it's 40% of older people in residential aged care never receive visitors throughout the year. So that's objective, that they're experiencing social isolation. Even though they're surrounded by people, they might not be connecting with people in an emotionally meaningful way.
Yeah. I mean, I would just follow up by saying that, we've been doing some research on social connection and social isolation, and a lot of people experience it as quite a kind of almost like a desolation or emptiness, and are kind of desperate for some sort of actual emotional connection. And a lot of people have got more sort of, we have a model called the circles of connection, and it's got like intimate contacts, helping contacts, groups you belong to, and then kind of like wider contacts in society. So a lot of people feel they have a lot of these wider contacts, but they kind of have this desperation for this like close connection with people. And I think part of the issue with people in residential aged care is also that they are they're kind of taken away into this, like, as some of the people we've talked to, it's like a cruise ship in some ways, as kind of a situation where that's where they are and they don't have a lot of choice, and they have a limited choice of things available to them. And also because of the way that our society regards and treats older people tend to feel undervalued or not valued, or even, kind of discriminated against. And so all of these feelings of isolation and separation and being undervalued, they all kind of come together in this kind of scenario. But, although there's obviously a lot of mitigating factors, which you might want to get onto in other questions, I guess.
Yeah, that's really interesting. I certainly hear about how important this topic is. In saying that though, I don't see it publicized very, very widely, at least compared to things like dementia, mental health, rehab, all the other COVID-19, right? In the past couple of years, it certainly doesn't have as much attraction, though I know how important the topic actually is. So